As merciless as coronavirus is for so many, it is particularly aggressive for Black Americans, who seem to be at highest risk for a variety of reasons. Our cover story is reported by Allison Aubrey of National Public Radio.
As protests against police brutality began in late May, Keishia Matthews lay in a hospital bed battling COVID-19.
I really could not breathe at all. I just felt no air, no nothing. It was scary, it was terrifying, it happened fast. I didn't know where it came, it just hit.
She was treated by a team of doctors at Johns Hopkins University, including Dr. Panagis Galiatsatos.
I couldn't forget how she looked, the fear in her eyes, realizing she could die.
Keishia Matthews is a Baltimore native and was just about to graduate with a degree in criminal justice and forensic science from Coppin State University. But it wasn't clear if she'd survive.
I've never been that scared in my life. I didn't think I was coming home. It was hard.
Young adults are much less likely to die from COVID-19, but
Keishia was telling us her pre-existing conditions. As soon as she said diabetes, my heart sank. Right? I wasn't just dealing with now a 27-year-old. I was dealing with someone with one of the variables that we know is going to create a likelihood of worse symptoms.
According to the CDC, people with chronic diseases such as obesity, heart disease, and type 2 diabetes are a staggering 12 times more likely to die from the virus. And Black Americans have a higher prevalence of these conditions. Keishia was in the hospital for 3 weeks and on a ventilator for 6 days. When she was finally released, she emerged with a new sense of urgency.
Taking my health seriously, I need to. I don't ever want to be put in a situation like that again.
But her determination is just one piece of the COVID puzzle. The lifestyle changes needed to tackle chronic disease are often difficult to make in economically challenged areas.
One of the reasons why we see disparities ravaged in the minority populations is because those kind of lifestyle requests are really hard to do in neighborhoods that are plagued by homicide, neighborhoods that are plagued by food deserts. And the challenge there is resources to give them the opportunities to overcome that. We're at a pace that, in my opinion, is unethical.
Hassan Amin is the imam at Masjid al-Haq, a mosque in West Baltimore.
People are now hungry and they are hurting. They were hungry and hurting before the virus. Now they're really doing so because a lot of times the people we serve, these are the ones that are the last hired, first fired. Dr. G, go ahead, do your work.
Dr. Galiatsatos has teamed up with faith leaders, including Imam Amin, to address these obstacles.
I'm Dr. G. If you guys have any questions about COVID-19, I'm happy to answer any.
On this day, he's answering questions at a community event at the mosque, where fresh produce and grocery gift cards are being handed out.
When is it over? Oh, dude, that is the best question, right? How many people here are sick and tired of it?
I am.
This is where nature and God really dictate their own pace, right?
Dr. Galiatsatos' goal is to build relationships.
What's your name?
Emery.
Emery. Dr. G.
Medicine is a public trust. We can't just know the science, right? We have to know the patient and we have to know the community.
It is lethal, man. This is why we're doing what we're doing today. It's a good question.
So by bringing him here, you're building bridges.
Oh yeah, we're building bridges / filling in gaps. Because right now, since the people don't trust hospitals and doctors.
The hope is that partnerships between doctors and community leaders like Imam Amin can help build trust.
Okay, folks, you're getting a little too close. We have to do social distancing.
Physician Sharita Golden is the Chief Diversity Officer at Johns Hopkins Medicine.
The reason those trusted messengers are so important is that there are many of these vulnerable communities that are distrustful of the healthcare system. So this is because of prior historical experiences.
From the infamous Tuskegee syphilis experiment in the 1940s, when treatment was deliberately withheld from Black men, to Dr. James Marion Sims in the 1800s, who performed surgical experiments on enslaved Black women with no anesthesia, the history of racist mistreatment of Black Americans by the medical establishment is well documented. And what still persists today is the misperception that Black people are somehow different from other groups of people.
There's been sort of this questioning that are African Americans more genetically or biologically vulnerable to contracting COVID-19, and there is no evidence of that. There's nothing genetic or biological about working in a service sector where you have to be essential and you're just going to get exposed because you happen to be there. So there is no evidence that genetics is playing into this at all.
But another factor that likely is playing into this.
What about the role of stress?
Stress can make people more prone to infection. So what happens is that it alters your body's immune response so that you may be less likely to be able to fight infection as well. The structural racism, that induces a form of chronic stress, thinking about where's my next meal going to come from? I've got to work 3 shifts tonight, and then I have to worry about my child getting pulled over by the police. Like those chronic stressors, even though you may not feel you are acutely stressed, they are still impacting your hormonal system.
Looking back, COVID-19 survivor Keishia Matthews says she was under tremendous stress when she got the virus.
Working a full-time job, going to school, 7 classes at one time, 2 hours of studying, 3 hours of sleep.
And all of that takes its toll. Imam Hassan Amin points out Black people in Baltimore and around the country are more likely to have the types of jobs that you cannot do from home.
And that means that they are exposed to all kind of people all day long, coughing and sniffling, whatever, and then they end up maybe catching something and then may end up taking it home to their family.
It's one more reason why Blacks and Latinos are about 3 times as likely to get COVID-19. But Keishia Matthews says she's now full of hope. When she emerged from the hospital to see Black Lives Matter painted on streets and white people joining Black people to protest injustice, she saw it as a symbol of progress.
My goal is to be an FBI special agent. That's my next career goal. And that also goes along with me and my health goals. You know, you have to be healthy, fit, in shape. So another thing that's motivating me.
And Dr. Golden says that Keishia Matthews deserves a country that rewards that determination.
This is an important time for us as a country to really think about what are the things we value, what do we want to focus on, and how can we use our power of legislation to really address the issues of making our communities healthier, making our communities safer.
What do you think your role is in pushing for change in your own community?
I want my people safe. I want them to have someone they can trust. I want to have someone they can look up to.
You seem hopeful.
I am hopeful and determined. I'm going to always be hopeful.